Hello, I'm Layne Hartsell with the Korea IT Times, and I'm here with Zeh Wellington, a friend of mine from Virginia, who is also now the president of the Illinois Nurses Association. He has a doctorate in pediatric cardiology, where he followed uh, pediatrics, the children after they had congenital heart failure or some kind of heart problems throughout their life to check on them. And of course, he did his doctorate in this area. He's now at the Ann and Robert Lurie Children's Hospital in Chicago. Welcome, Zay, to the show, and look forward to talking to you.
Hey, thank you. Uh, Thank you very much for having me. Again, I am Dr. Zeh Wellington. I am the Director of Surgical Services at the Ann and H. Robert Lurie Children's Hospital in Chicago. I'm also an adjunct professor in Illinois, and I serve as the American Nurses Association Illinois President, representing all 350,000 Illinois. And I have a national office for ANA, which I help to represent the 5.2 million nurses of the United States. So thank you for having me this early morning. Thank you very much.
It was great to have you. And I've been following your work for some time. You gave a lecture actually back in November. I think you maybe were at Las Vegas or something, and you were working on OR management and this kind of thing. So that's why I contacted you. You're also involved in the political aspect of healthcare. So I'd like to get some, first of all, let's talk about your background and how you got to your position and then what you're up to. And we can move on to talk about some of the technical stuff. So tell me a little bit about your background.
Right. Wow. To speak of an evolution of a nurse, I was a frontline nurse for many years. And then I went on, when I got my bachelor's, I started concentrating on nursing bedside. Then my master's, I started thinking about how can I make a difference in the hospital, in the community, in our state. And then when I received my doctorate, I started thinking, how can I develop a national platform to help the nurses of Illinois, the United States? Now, I have to give credit where credit is due. I did have help in Illinois with a number of election managers who helped my campaign in Illinois. So I spend a lot of my time traveling back and forth of Springfield, Illinois, which is the capital of Illinois. I also spend a lot of my time in Washington, D.C., and I'm also on the lecture circuit. So, yes, I was very honored to have been asked to speak in Las Vegas. I've had a lot of great opportunities speaking across the nation because spending time traveling around Illinois and the United States and working with the other state presidents, meeting with rural nurses and school nurses, nurses in the community, not only nurses in academia and nurses that work in the hospital, but we need to be advocates. We need to speak up for our nursing profession. So, where did this all begin? So, Professor Hartsell and I were in our undergraduate degrees at the Virginia Political Institute and State University, I'll say Virginia Tech in Blacksburg, Virginia.
Right, we went to school
Um,
together.
we did. And then it started evolving. So I thought, how can I help the patients of Illinois and patients of the United States? Because I'll be honest, healthcare um, is in dire straits now. We are at a point where our healthcare nurses are at all-time low. There is violence, as you'll see in the news, which is very distressing.
Mhm.
Um, want nurses to work to the height of their licensure. Let me give you an example of that. So, traveling around Illinois, I've spoke in DC a couple of times about the ICANN Act, which is House Bill 2713. You know, we have a House and a Senate. This is represented from the House bill, and it's approving care and access to nurses. So this all stemmed from a patient that I had spoke to in rural Illinois, a diabetic patient who needed something simple as diabetic shoes. The nurse practitioner with all the training, knew this patient needed shoes. This is an example. So wrote an order for shoes. However, there's two podiatrists in the rural part of Illinois, and one of them had to travel and double sign on this nurse's medical order for diabetic shoes. And I thought to myself, how sad. This patient had to go to the doctor twice, charged twice, where the nurse really had the authority and the training to provide these shoes, if you will, for this very needy patient. So back and forth to DC, I've told this story many times to our legislators to try to understand the plight of the population in the rural part that don't have access to healthcare, where our nurses need to work to the height of their licensure. We're also working on the National Nursing Workforce Act, which is Senate Bill 1150 and House Bill 2411. And this is a 2-year test pilot to better evaluate the recruitment and the retention of nurses in the United States. I spent a lot of my time going to elementary schools, speaking to groups around Illinois, encouraging students who are interested in science to get involved. You don't have to be a doctor or a nurse or an anesthesiologist. There's so many avenues and help that's needed for the patients across our great state. So I guess the reason I started getting involved, nursing in the United States is the most underserved voice. Nurses don't naturally speak up. And it's okay if you don't want to speak up, but I tell you, if you don't speak up, someone will speak up on your behalf. If you don't feel comfortable speaking, someone will speak for you. So I want to represent the nurses in our state, one, to encourage nurses to vote. Voting is very important, to be represented, to tell their stories to their state house, their community, and also in Washington, D.C. So I guess that's where it all stemmed from. It was just my hope to better serve not only pediatrics, but geriatric patients across the United States.
Mhm.
In Springfield, we are working on a number of bills that we're trying to get through committee. A bill is introduced by a legislator, and once it gains traction, they'll invite me to come and speak to the Senate or the House to speak pro or on certain bills that is presented to them. In the United States, nurses work under a Nurse Practice Act, which all of our the way we practice medicine is under our Nurse Practice Act. And 80% to 90% of the Nurse Practice Act is controlled by the state house. So it's very important that nurses go to the state, your capital, and speak up for your patients and the way we listen. So I guess that's where it all stems. Traveling around Illinois, traveling around the United States, speaking to different groups, and seeing that nurses need a voice. If not someone, it should be me, or it should be someone to speak up for the nurses and try to campaign for healthcare and for the better serving of our population in our state and in our country.
In your case, so yeah, when I saw you speaking, this was about more specific, like technical nursing. But in your case with the politics, now
Mhm.
you go about meeting with different people all over the country, right? Not just for
Correct.
Illinois. And so
That's
you're working on the federal level
correct.
in Washington. When you go to Washington, what is your general, I guess, sense of the conditions there right now?
Well, with the new administration, um, it was we are tailoring our message to reach both party sides. We want to work bipartisan, work with both sides, Republicans and Democrats, to get our message across. So I meet with representatives, senators, not only from Illinois, but whoever represents or is championing a bill about nursing that has to do with healthcare and nursing. And I would speak to them, tell them stories, answer questions, sit in front of the panel of House members or Senate members, where if the bill started in the House or the Senate, that's where we would begin our talk. I am very thankful for the nurses who do letter writing campaigns, email campaigns, are speaking to not only in the national level and the state level, but the community level as well. So I try to represent nursing in all levels, but it starts at home. It starts in your community. It starts in your area to meet with your local community leaders, and then your state leaders, and then your national leaders. So, yes, certain bills, they'll call certain nurse experts, if you will, to come on behalf of certain bills that are gaining traction either in the House or the Senate going through. And we try our best to relay stories and come in numbers to meet with our representatives, to meet with their people in their offices to try to relay our messages. There were messages of hope and messages of change. So it is an administration here in the United States. I'm sure everyone knows that from across the globe. So how do we work? How do we manage? How do we change? Well, it's time that we
It looks like
um,
it looks like
our message.
looks
Both
like
sides.
President Trump has been really caught up or having to deal with the, foreign relations like Ukraine and Gaza and so forth. Has
Correct.
President Trump done anything or been able to look at domestic right now? I mean, as far as what you're talking about, or is the Senate or the House doing it? How does that work?
It does work well. President Trump, just got a new all of his cabinet members. The So the Senate, the House gets bills to go through, and then they'll go to the President Trump's desk, and he'll sign them into law, if or he may veto them. So there is a lot of work internationally being done by President Trump, but I feel that you may see in the news some of our hot topics or some topics that are, very popular. But I am working behind the scenes with lobbyists. We have 3 lobbyists here in Illinois and multiple lobbyists in Washington that represent nursing. And if there's healthcare bills that are going through, we will ensure that both sides see the message and that the bill is represented in the best light. So, yes, the new administration is making some changes, some for the better, some, in our opinion, for the worse. However, I feel that we have some very dedicated, very passionate leaders that were elected to office that are willing to listen, willing to listen to both sides of the story. And so, yes, we are trying to push the envelope and trying to encourage lawmakers to understand what's going on, not only for pediatrics, for geriatrics, for school nurses, for nurses in the community, for rural nurses, for IT nurses, for telemedicine. So we're working hard about that. So yes,
Yeah.
you see and you hear in the news a lot that's going on behind the scenes. We're working on trying to make definite positive change.
Yeah, for the domestic situation, it looks like there's a
Right.
there's a lot going on. Of course, everybody eventually is going to get sick, whether they're in any side of the political spectrum, and certainly children are nonpartisan. They don't have anything to do with the politics, right? The children. In your case, I really am impressed by the dedication and so much, like for example, I've known you for 50 years. It took me 3 months to get with you here. And so this is really a good chance to talk about these things. And I wanted to ask you about the pediatrics, like the children. When you were talking about uh, when we were off the recording, you were talking about following the children through their life. So you will start when the child is born and they have maybe like a congenital heart failure, or is it like COPD, but COPD comes from something else, right? Can you talk about
Is
that, how this, yeah.
in the lungs, but right, a child intrauterine, we could tell if they're born with a single ventricle, or there's four chambers to the heart, and there's multiple things. A lot of children that are born, we have surgical interventions that we do in stages as they grow. Um, there's multiple congenital issues. A lot of these children are on a bridge to transplant, heart transplant.
I see, yes.
And we will follow them throughout life, um, just to ensure that they were getting the care that they need. Um, yes, this is a very vulnerable population. It's very expensive for the families. It's expensive for doing this type of care. So we want to ensure that these families are financially equipped, and they have help. We want to make sure we're taking the best care for these children. I'm very proud to say, um, at the Medical University of South Carolina, where I worked for 14 years, at Duke University Hospital in Durham, North Carolina. Duke has a very robust pediatric population, a robust healthcare system. So across the country, we are taking care of our kiddos. They are very special to us. It's very vulnerable. Um, um, so also taking care of the families and taking care of the community and taking care of their families. You know, children, um, they're not healed overnight. And so we do follow them throughout life, and we do work with the parents and the community, and to make sure they have the care they need when they leave the hospital, and making sure caseworkers can manage them and get them back to the hospital, ensure they're being compliant with their medications, ensuring they can afford their medications. So it's a long journey that they are on, but I have to admit, their hope and their tenacity and their will and their courage um, is is really what motivates me to do this, traveling and speaking and trying to encourage healthcare. And thank you for being so. Thank you for inviting me today, uh, because I do spend a lot of my time traveling and speaking, but it's all for the kids. And others are speaking on behalf of our seniors and our adults, who need help as well. So dealing with sick patients is a calling, if you will. It's sometimes it's heartbreaking, and sometimes it's very rewarding, the miracle of life and the miracle of death. But we want to make sure these patients have a good quality life, and they're getting the health and the care and the nursing care and the professional care that they richly deserve.
Yes, yes. Well, I think this is a good place to end off, and then maybe in another, after some time with legislation and all of that, we can get back together and talk more. So
Great.
thank you so much. I've been speaking with Zeh Wellington, who's at the Ann and Robert Lurie Children's Hospital in Chicago. Thank you so much.
Correct. Thank you.